it. And so this is an invitation for you to write your words, or you can upload images, you can upload GIFs, whatever you like to collaborate in this virtual wall of appreciation. And we'll be sharing that through social media and encourage you to do whatever with it that you like to share within your networks as well. And then at the end, we'll talk about Nursing Week activities that are happening and some calls to action that we have right now with through our policy department. So I think I'll pass it on to you, Doris. Oh, just before I do that though, today's webinar, so we are going to record it. So Olivia, if you haven't pressed record yet, you can do so now. And please use the chat box as usual for your questions, your comments. We will allow you to unmute your line when we're hearing your stories. And then also always a reminder to check the RNAO portal for up-to-date information. And actually, this week we have another portal that's available for you, and that's our Nursing Week portal. So it lists all of the events in case you want more details or you want to directly register. We are talking about that towards the end, but please visit the Nursing Week portal as well. So I'll pass it over to you, Doris, for opening remarks. And we just have the screenshot here of our thanks from Doris and Morgan Hofferth, our RNAO president for Nursing Week. And I'll pass things over to you, Doris.
So this is, of course, a awesome Nursing Week on behalf of the Board of Directors, on behalf of all our staff, on behalf of Morgan and myself and everybody in the RNAO family, and the extended family of Assembly of Leaders, the extended family of the board, and indeed of each one of our 46,000 plus RNs and Ps and nursing student members. Mwah! Happy Nursing Week. And what a best way to celebrate that after being for a week in what it feels like a box match of trying to get the announcement about the second dose vaccination for our colleagues. Just to tell you the power of nursing in terms of the good for everybody, because I think that is a story, Susan, you are asking for good stories and good messages about our profession. Well, this is probably one that Florence Nightingale would be smiling today. She will be smiling even more on Friday, because I will tell you more what Friday is all about. But today, after a week of dialogue with the Premier's office, Minister's office, endless numbers of you that tweeted, retweeted, and wrote about that. And it all started, and I do hope that she's joining. I did ask her to join, but amongst 140 people plus, I don't know if she's there, a nurse by the name of Amanda that works in Blue Water in Sarnia, that called me about a week ago to tell me how desperate she was because her second dose was canceled. She works in an emergency department, a very busy emergency department, and she is an RN that has openly shared that her husband is immunocompromised. So you can imagine the pressure and the stress of thinking that yes, you are protected, but not really fully protected. And as much as you are careful, you may catch the virus and give it to your own partner. So that, in addition to family members that call me with very dramatic stories that I am not going to share out of respect to them, but needless to say that you need to know we have nurses in ICUs as patients, not only as nurses caring for patients. That triggered us to actually demand that we needed to have the second shot for our nurses. We knew all along that if we get it for nurses, like always we do, everybody else will in healthcare, and everybody will and is well deserved. So kudos to Amanda, kudos to Brigitte that tweeted madly, kudos to Amy and Sarah from Gritty Nurses that tweeted madly, to Deb and her colleague from the 2 nurses and a dog that tweeted madly. Yes, we had hiccups, including with a few dogs that didn't understand what we are going after. But nursing knows, nursing knows whether it is about patient care, we know, whether it is about community care, we know, and whether it is about asking something for our own profession that then expands the good for everybody else. Nursing knows. So with that, colleagues, our deepest, deepest thank you and admiration to all of you that joined on that Vaccinate Immediately campaign. I would love for Madison if she can put the beautiful a drawing that Alfred had made for it. And Madison, to you, a special thank you, and your colleagues in the media that have been so busy, both tweeting and going for the interviews, etc. Um, it shows that when we are together in one voice, we can achieve everything. And you will see my column because after I heard that this was going to happen this morning, and I reflected a lot on the power of nursing when we come together. I reflected a lot about the tremendous relationship that RNAO has with its members, whether it is Marian knowing people to whom to go for media interviews, whether it is the policy department going and making resolutions live, whether it is Susan, you and the team with BPSOs and BPSOHT, whether it is me answering to family members that are crying and responding and getting the answers that we need, or PG or IFRA, or all of you. And by and large, then the extended nursing family, which is all of you, the 140 people in this collective today, our deepest admiration to you and to all the ones that are working in the front lines and in the boardrooms and in the classrooms. Today, a big, big thank you. It is our day to celebrate. And let me tell you, it is just the beginning. It is just the beginning. Michelle Landsberg, who is not here today, but opened the doors in many ways to nursing back then in 1996 when I came to RNAO. She said to me, the sleeping giant has woken up. And I felt that in my bones this weekend when I saw the number of nurses tweeting, retweeting, putting their own messages of why we needed what we needed, including the removal of the 1% cap on negotiations. I felt it in my bones. And you watch it, politicians of all parties. The sleeping giant has woken up in full force and will never go back to the genie bottle. We are who we are, and we advocate for the good of our public, and through it, the work of nurses. So let me tell you what Friday will be about, because Friday, which is the end of nursing week, we are going to actually demand that the cap on minimum wage be removed, that the $1 that people needed to get this year, which was removed, be put back, because living in poverty, being a working poor, means we are going to see more illness. We are going to demand that the sick days be permanent sick days for people that do not have that benefit. And that includes some nurses colleagues, some nurses that work as casual or for agencies, they do not have that benefit. It also includes the many workers that are in warehouses, like, working as precarious employees. They need the protection, not because it's the political right thing to do, but it's the nursing right thing to advocate for. So watch it, Ontarians. We have your back, and we are there for you, and also we are there for our profession. With that, on behalf of Morgan, myself, the board and the staff, and our assembly of leaders, thank you, thank you, thank you for being the, the army of force that nursing is and needs to be for our profession and for the public we serve. Thank you. You're on mute, Susan.
Thank you so much, Doris. So let's just jump right into hearing from you. Lynn can go first and we can unmute her line to share because she put her hand up right away. So this is an opportunity for you to go off of mute and speak to us about your examples of nursing leadership, knowledge, compassion, bravery, dedication, collaboration, creativity this last year. Or you can write in the chat box. But let's hear from Lynn. Lynn, go ahead. Okay. I'm not sure what happened to Lynn, but anyone else who wants to unmute their line and share their stories. Oh, that was an error, she said. Okay. We heard recently just one example of creativity and innovation was, and some of you might have seen this on Twitter, it was making its rounds of a nurse in ICU, I believe, who put warm water in a glove and put that so that the patient was able to feel, I guess, a warm hand and provide perhaps some comfort for someone in ICU.
So those were nurses, just so you know, Susan, that I got that picture. Those were nurses in Brazil. Because you know the extent of illness. If we have it difficult here in Brazil, it's impossible for the nurses, impossible. So in the midst of the tragedy that they have in Brazil, nurses came up with that and make the rounds around the world. So yes, amazing. Another piece of creativity was what nurses here did on the weekend. And if you look at RNAO, and Madison can put it, if you look at RNAOs, the back of RNAO is what Susan has there. And then the icon instead of the picture is a black ribbon. That black ribbon is a really grassroots initiative of nurses that started it to remember those who we have lost. So not only to remember to go for the future, but remember those who we have lost. So another tremendous piece of powerful creativity. Many are using it now. And Madison, I know, put both. Feel free to use both. Feel free to use in the back. If you look at RNAO, you will see it. In the back, the nursing week that Susan has in the back. And then instead of your photo, that black ribbon is super powerful because now when you look at tweets, there are tons of them, tons. So kudos to those that started it.
Great, thank you. So we can hear from any sector, any role. We've invited members of the public as well. We've invited the media. I know that Doris has put a call out to some of the media in case they are interested in sharing some good stories or thanking nurses for their dedication and leadership. Ola has raised her hand, so let's hear from Ola. Thank you, Ola. Let's see. Allowed to talk. I think.
Hi, everyone.
Hi, thank you.
Ola.
For your patience.
My name is Ola. I am a nursing student at York University.
Ola, put your camera so everybody can see you.
Okay, just give me
you.
Yeah, sure.
Ola is a star already, and she's in the nursing school. She's a star. Go for it, Ola. We need to get to see you and remember.
Okay, let's see. I don't know why I cannot.
Can you guys allow people to put their cameras? Susan, the reality is you can take the slides and put everybody in camera so we see one another. Is more dynamic.
I just turned off the slides, and so Olivia can promote people to panelists, and they
Promote everybody to panelists.
Okay.
It's good to see people.
And there's Ola coming on, I think.
Olivia, can you promote everybody that wants to be promoted? The more the better. Let's cover the screen with people.
Sure. If anyone wants to be promoted to panelist and wants to join online with their cameras, please let me know in the chat box.
Maybe what you can do, Olivia, is actually put everybody, period, and they can turn their camera off if they don't want. People, you know, we have a great nursing community, 143 people here. Let's put everybody, let's democratize this piece. It's actually important and it's good. So let's just take that camera, you know, thing that we manage it. Let everybody manage their own.
And in the meantime, Ola, we can see you. And I think you're off mute, so go ahead.
Oh, hi, everyone. Thank you so much, Dr. Doris, for always sharing me. I just finished my third year in the nursing program at York University, and I just started my clinical extern at McKinsey Health. And I would say nurses are leaders all the time, even at the bedside. You know, it's COVID-19 is very overwhelming. I didn't really understand because I've been away from the hospital for over a year. And you see patients come into the hospital all the time. You know, even if they're positive or negative, nurses are there every day, every second. And you can even see in their eyes how tired they are, but they're there. The compassion is there. You know, they advocate for these patients, you know, even when their families are troubled. It's the nurses who take care of the families, not just the patients, but the families as well. So what I say is nurses are leaders every second, even when they're outside of the hospital, like on Twitter, you know, they advocate for the public, and every time, even just teaching the community about vaccines, the importance of taking vaccines, or why you should social distance. Those are the nurses. So I really respect and I admire nurses a lot, and I'm very glad that I am in this path. And someday, I just hope to be like all the great nursing leaders I see. That's
You
all I
will,
have to
Ola,
say.
but we still couldn't see you. Is
I
your
know.
camera on?
Yes, my camera is on. I don't know what's happening.
I think it's just the light.
Oh, now, yes. Okay, good. Olivia, could you let all the cameras on? Because I only see Susan and Irmajin and Heather. I don't see everybody, and I think people would like, oh, here we go now. Fantastic. Now we see lots of faces. I see Gloria, Anita, everybody's there. Wonderful. Who is next? Gloria, share something from your practice. So powerful.
Yes, I can share something. I'm an older nurse, but I'm still very much wanting to nurse. And I've retired several times, but always found another job. And when the pandemic came, the clinic, the health and foot care clinic that I was closing, I was operating or coordinating, had to close. And it was in a large faith community, and they could not see continuing it. And so I was heartbroken because this had been sort of what I was doing, and it was reaching out to a very vulnerable community in the Church, Sherburne, and the Queen Street area. But I have found another job. I operate 2 foot care clinics at 2 locations for Margaret's Housing and Community Support Services. They were very eager to offer foot care. And so the 2 locations, I have a foot care clinic once a week. Now, what really surprised me, one location is respite, and we have younger men and women in crisis. And they have lost their housing because of mental health. They're on the street and they can come in. Now I thought, what will these people want foot care? And I have found that, and they've told me there too, at first nobody wanted it, but now I have some of these youngish people signing up for foot care every week. And they say to me, it's just wonderful to have somebody to talk to and to listen and understand what they're going through. And, you know, this, I'm used to providing foot care for the chronic, elderly, long-time person living on the street, but these younger people in crisis, and they have an opportunity from this location to move on in their lives. So I found another position and I'm still being a nurse. And one thing I can do, I can talk to them about vaccination, about COVID, asking them and listening to them. So that's my story right now.
Thank you. I still see people that would like to be in the screen. I'm not exactly sure if we can do like on staff meetings that everybody that wants can be in the screen. Olivia, maybe you want to give instructions to people. I saw that you wrote some, but maybe people are not clear how to do that if you can help them. I got a few WhatsApps on that.
Hi, everyone. If you want to see more participants, if you go to the top right-hand corner, it will say view, and just click on gallery view, and it will fill your entire screen with everybody who's online.
Thank you, Olivia. Thank you. And if more people, because if more people want to join, how do they do that, Olivia? What do they need to click if they want to be on the screen?
If you are already joined as a panelist, just go down to the bottom left-hand corner. You will see a little icon that says start video. Click on that and it will activate your video camera. If you're not part of the panelist link but would love to join us, let me know in the chat box and I'll be able to switch you over.
So Olivia, can you just free up everybody? Can you free up the cameras?
Well, I can promote everyone to panelists, but it's up to
Sure,
the
let's do that, Olivia. Simplify life so we can get moving. Thank you. Please do. Thank you. Anita, you want to share about your work that is different and very inspiring? And it's totally nursing in our view. It's a Florence Nightingale nursing type. So was Gloria, by the way.
Sure. Can everyone hear me okay?
Yes.
Awesome. Okay. So I'm Anitas Story. I'm one of the board members on the board of directors. So I just want to say happy Nursing Week to everybody on behalf of our organization. I work, like Doris mentioned, in an atypical position where I work as a director for risk management insurance for Toronto Community Housing. I definitely really enjoy the work that I do, and it's nice to be in an organization where not everyone speaks the same healthcare language like I'm accustomed to in other organizations I've been with. So it's been an interesting journey in terms of getting everybody to speak or share their ideas from different perspectives to benefit the health of our tenants, partnering with agencies and doing work that will lift up the lives of our tenants. And so, yeah, my work's a little bit different, but it's very rewarding. Thanks.
Amazing work, Anita. It makes a huge difference for people. Who wants to jump next? I don't know if Amanda, oh, here you go. Marielle, go for it. And I know that Amanda was going to join too. I don't know if she did, but if she did, I know she wants to share about her story.
Hi, everyone. My name is Muriel. I'm a recently new graduate from Ryerson University, just a few weeks. And right now I'm actually, I'm a clinical extern part of Women's College Hospital. And so they've started like a pilot program externship because out of everybody else, they didn't really have an established extern program. So it's really nice to be, as a new grad, to be already part of the working field. And there are a lot of great pathways to go with my career, despite the pandemic hitting hard in every field and everybody. It's just like I love our nursing community, how present we are with each other, and how we can use each other as a resource. So thankful for RNAO and all the nurses. Happy Nurses Week, everybody.
Happy Nurses Week. Welcome to the profession.
Thank you.
Javier, do you want to join to share about working at RNAO as a relatively new staff and the transition?
Sure, I noticed I accidentally put my hand up and I was like, oh no.
I didn't even see your hand up. Here you go. So
Yeah, so I was actually reflecting this morning because last year during Nurses Week was quite tough for me. I had recently just volunteered at a long-term care home facing in the midst of the first wave of the pandemic, and which was quite traumatizing. And this year, I've recently joined RNAO. I am about a couple of months in, or over a month in now, and I am enjoying being a part of the team and being able to listen to just everyone's stories, and being a part of an organization that's advocating and listening to everyone that's at working front line as well on Twitter and seeing everyone's stories. So just excited to be here with everyone.
And you want to share what you do at RNAO?
Sure. So my role is an implementation science manager. So what I have been doing is connecting with different BPSOs, and I'm part of the process of organizing our BPSO program. So working with different organizations across Ontario to implement best practice guidelines into organizations. So my role in that is in the sense of a BPSO coach to work with organizations towards their goals. So cohort 7 is just launched. So I'm working with 2 different organizations and we're just starting that process right now.
Fabulous, fabulous, fabulous. I see Oba. I don't know if Oba wants to share. And I also would love Arlene. Arlene, tell us the difference between your work and the similarities between your work on Qatar and what you did there and how you landed then at RNAO.
Sure, Doris. Good afternoon, everyone. My name is Arlene Masaba. My background is pediatric nursing, and then most recently, I was a clinical instructor for a university in the Middle East. So, as what Doris had said, Qatar. When I started working there, I really wanted to bring RNAO because, like, I believe in it. And then from the get-go, like, I was a member. So from that point on, I started working with the dean as well as the instructors, and then just trying to get the BPS over there. And we were fortunate because our application was accepted by RNAO. So we are actually the first academic BPSO in the Middle East. And we have just like reached, like a year ago, we had reached like our 3-year pre-designation. So after some time, like I applied as an implementation science manager for RNAO. So I joined RNAO from January of this year, and I think it was full circle. So from being a member to a BPSO lead, and now I'm working just like Javier as an implementation science manager. So the focus that I have, so like Javier, I'm also a coach for cohort 7, and I'm also helping to facilitate the BPSO Champions Workshop with 2 other awesome nurses, Grace and Connie. So I think this is like, to be a nurse and to be with all of you today is a great honor, because I think the pillars of healthcare is really nurses. And I've seen like nurses like in different settings, and the job that we do is really great. So happy Nurses Week, everyone.
And share with us what the students did. It was amazing when we did at RNAO the Mascathon. which was really a creative piece of a Victoria Larcon that did all the with graphics, and it was amazing. Share what your students did there, because that it was really inspiring.
Sure. So we wanted, so the BPSO movement in Qatar is relatively young. I say young because like most of our members are champions who are students. So they really, so once they have joined the workshop, their first question was, Miss Arlene, so what do we do now? So you could really see their enthusiasm. And it was around the time that the pandemic started. So they really wanted to do something. And we saw from Twitter that RNAO was doing Maskathon. So it was actually a number of the students have asked whether it was possible for them to say why is it important to wear a mask during the pandemic. So what the students did was to take a picture of themselves in different parts of Qatar. So it could be a shopping mall, it could be like at the park or wherever. But what they did was to say why it was important to them to wear a mask and what does it mean like as a champion. So we had like stories every week of students, and what they call that, RNAO picked a number of them to be the champions for the week, and that really did a lot to boost their enthusiasm, as well as like do everything that they can to be part of the movement. So they're still doing it, which I'm really, really proud of.
And we are proud of them. I see we have Glenna, a seasoned member of RNAO, if I recall correctly. Glenna, would you like to give your reflections on our profession and on RNAO through the years and now? Would you feel comfortable? I thought I had seen Glenna, but I may be wrong. Who else wants to share?
There we go. I've been a member since 1960. And I had finished training at Toronto Western. And before we could leave, we had to sign on the dotted line when Blanche Duncanson said, "You will." So we did. So I've been through several different positions over those years. But now I've been retired since about 2002. And I joined into a multi-church group that imports refugees to Canada about 15 years ago now. And that's what I spend my days doing. I look after their health care, not doing their health care, but seeing that it's done. And we have a lot of fun, some frustrations, of course. Right now, there's a big language barrier with the family, our newest family, and we, because we don't have ESL on now during COVID, so it's some sign language and some interpreters, and we managed to communicate.
So beautiful, Glenna. I thought I had seen that you had joined, and how apropos what you said. First of all, your work to this day is nursing, whether volunteer or paid, is nursing 100%. And also what you said, they told me sign on the dot. It reminds me of an awesome nurse leader that I want to just share with you, Josephine Flaherty. She was a chief nurse in Canada for quite some time. And Josephine, in her old age, I used to go to the nursing home where she was in Ottawa. And she always would say to me, no one asked us in those days. They said, you join. That's it. You need to join. And she was like strong as it can be. And she always told such awesome stories about nursing during her era. up to when she was chief nurse. So those are the pillars that we stand on, and Glenna, you are one of those pillars too. So thank you.
Thank you.
For the ones like Ola that are coming to the to nursing, and the ones like you that are standing pillars. Thank you. Barbara, I see Barbara Anderson. Barb, you want to share? Barb is the one that brought the BPSO movement to her organization. Barb, I believe you're retired. I don't know. You may be also doing all kinds of things that we don't know about. Share with us, please, your journey in nursing a bit, the highlights and the inspirations.
Hello, everyone. This is my garden today, a little bit earlier. I retired from West Park Healthcare Center in 2018. That year, I received my 40-year pin from RNAO. I graduated from Durham College in 1977. I had a nursing instructor who said, you must belong to your professional association. I've been involved in RNAO throughout my nursing career. I was chapter president in Durham. I was chapter president in the Peterborough area. I served on the board of directors twice. The last time was when my daughter was a newborn, and she is 34 years of age now. During my tenure at West Park, I provided leadership for our BPSO status, starting in 2003. So for 15 years, that wonderful work. And since I retired, I taught at Durham College on aging course for RPNs in 2019. I participated in a NANDA review of the constipation and diarrhea diagnosis, and the book was just published, and I just received my copy yesterday on Mother's Day. I have just finished the chapter edits to the bowel elimination chapter for the Canadian Nursing Fundamentals textbook. I'm president of a National Nursing Specialty Association, Canadian Nurse Continence Advisors. And last year during the pandemic, we hosted roundtable discussions, surveys with our nurses to see how they were managing during the pandemic. Many of our continence clinics have been closed and our nurses have been deployed elsewhere. We've been providing Zoom education events since last fall, monthly education events, and many members participate live, and then we offer the recording, and many more members have accessed the recording. And so that's been a great support for our specialty association. So it's great to be on with everyone today. Look forward to hearing other stories.
Thank you, Barbara. And I'm going to ask, and then we are going to open to others. I'm going to ask a person that I have a nickname for her. The nickname she even has not been able to figure out is ATI. I'm going to put it there, and I'm never going to disclose what that means. Someone one day will discover what it means. But that's my nickname for my friend and colleague, Irma-Jean Bainok. And Irma-Jean, I don't know if you know that she's supposed to be retired, but she's back to RNAO. That has to do with my nickname, ATI, which I'm not going to disclose what it means, but it starts to give you cues. And Irma-Jean at one point was also the president of RNAO many years ago. And she also was the director of the VPG program for 10 years. So Irma-Jean, give us highlight of the journey and give us your words of wisdom and inspiration about RNAO today.
Oh, what a lovely opportunity, Doris. Thank you. And oh my goodness, this ATI, I may never figure it out. It sounds like an ATM machine. But...
Well, there could be correlations if you do statistical analysis, but one day you will figure it out. And if not, I will disclose it to you or someone else may.
Oh, you will, you'll have to. Anyway, highlights of the journey. I do want everyone to know that so much of my life has been grounded in RNAO. And I will never forget, as a very young professional, being a clinical teacher and
having to work with some of the senior chief nurses who were very tough. And it was not necessarily a lot of fun sometimes to face the senior nurse when you're, under 25 years old. And I found, though, after I was invited to an RNAO panel by the chapter where the chief nurse was sharing administration, some other nurse was sharing about clinical issues, and I was sharing about education. We were on an equal playing field at the RNAO level, and I will never forget that. That broke down so many barriers. And I've always learned then to use the professional association as a way to interact across different sectors and roles and domains of nursing. And it truly has never failed me. And I have really always said that to nurses wondering what would be the value of joining RNAO. And the value is the networks that you build, and of course, the knowledge you gain, and then the impact you can have by community voices. So that's certainly a lesson learned, and why really, I once said, this was in a presentation I made when I was vying to be the president of RNAO, and I said, nurses can choose to be RNAO members, and I want to help make that choice the right one. And I really feel that RNAO has just over and over, with the leadership of Doris, the leadership of the board, and the assembly of leaders, and really all the members, has continued to make that right to choose membership the right choice for nurses and for healthcare and our population. So that's my want to know what ATI means speech.
One day will become known and you will say, of course, now makes sense. Okay, who is next? Catherine, do you want to talk, Catherine, about leading change and the awesome work that we are doing with the model?
For sure, Doris.
Because people are living that model now.
For sure they are. It's such an exciting time to be seeing the collective action of nurses in this province, and how coming together and working together for change can be so effective. And just to see that leadership in nurses, as frontline nurses, and as former leaders as well. So I'm the senior manager for implementation science, and currently with colleagues working on a revision to our leading change toolkit and implementation resource. And that includes a focus on applying social movement action to change. And so, as I say, it's the words on the page, I think, are exciting, and I think will lead to new approaches to change. But more importantly are these examples where you see, like this morning, a push for accelerating the second vaccination for healthcare providers, including nurses, and seeing that collective action, how that can really affect change, accelerate, enhance change outcomes, keep nurses and other healthcare providers safe. So the words are important, but the actions are so much more. And just to see the power of collectivity before my eyes really makes me so proud to be a nurse and to be part of RNAO as the team.
Thank you, Catherine, for your work, and Shellyanne and all of the panel. I would love to hear from Matthew. Matthew from Chatham, Kent. Matthew, you do awesome work. Can we hear your day-to-day work?
My day-to-day work right now. Well, thank you for calling on me, Doris. I was actually dreading this moment.
But your work is too important, and what you speak is too important not to hear it. Including your reflections about the 1% that led to a very important conversation on the weekend.
So my reflections So I'll talk about my day-to-day event or life, I guess, at the moment. Mostly it involves listening, waiting for phone calls regarding COVID questions, as well as doing some substance use and mental health preparation work for once we're able to actually go back to our regular public health programming, and then vaccinating whenever I get called on to vaccinate. I also do a little bit of street nursing on weekends which is completely volunteer, and always a very interesting, eye-opening experience. As for my as for the 1%, it's not that I'm opposed to the 1%.
You may want to explain what we are talking about, because not everybody was engaged on the conversation.
Yes. So
and I give background though, how it evolved to even be a discussion. It's because we discovered that schedule, that OMA schedule that was nicely negotiated, right? So that's why people were asking to lift the cap, just so you know.
And I agree with that 100%. I think that it is very unfair that certain fields, certain professions in the healthcare industry are being able to go sit at a negotiating table, whereas others are not being granted the same opportunities. And unfortunately, it just goes to show the various differences in power dynamics within the healthcare industry, and that unfortunately, even though we are supposed to be colleagues and view each other as equals, that hierarchy is very real, and it does nothing but hurt healthcare as a whole, hurt nursing as a profession, and then greatly impact patient outcomes. Now, with Bill 124, which was passed in 2019, if I'm correct?
Yeah.
So,
2020.
2020? Okay,
well,
I wasn't sure.
Whenever the government came into power, you might be right. Yeah.
Yeah, I'm trying to remember if it was, I think it was, the election was 2018.
Yeah.
And yeah, so it was late 2018, 2019.
You're right. Likely you're completely right, I'm sure.
And so I just need to quickly clarify that I had a very poor sleep last night, so I might not be mentally as on my game as I normally would be. But so what Bill 124 essentially did was, well, one aspect of what it did was it capped off annual increase in pays and salary for nurses, or wages for nurses, by 1%, which is half of what inflation is, which inflation normally annually sits around 2.2%. So there's that impact that it will have on keeping nurses as a competitive in regards to payment structures, keeping nurses competitive. So my concerns with some of the language that was being used, and it has nothing to do with the fact that it doesn't change the fact that nurses' work continues to be undervalued and underappreciated within the greater political scheme of things. And that's where my personal thoughts on it became more so my statement around it, in that when we look at how nursing fees are distributed, we need to begin looking at not just the immediate facility, the immediate organizational level, not the municipal level or even the provincial level, but we need to begin taking it towards the federal level. And I did a little bit of homework after I made that post, just because I wanted to make sure I had all my facts and ideas up to par. And I found that on average, Ontario spends about 17, and I also pulled this from an RNAO document, so I do have to give credit where credit's due. On average, Ontario spends 17.3% of its GDP on healthcare, which is 4% less than what the national average is on healthcare, which is 21.8%. The federal government spends 11.5% of GDP, or annual GDP, on healthcare. So and also I'm going to take this down to a hospital level, and I'm going to focus on hospitals not as a way to leave out public health, which is where I work, or home care, which is a whole other structural issue that really needs to be addressed in how home care nurses are paid. But so just for simplicity, I'm going to look at hospitals. 60% of hospital budgets are allocated towards wage compensation, and approximately 70% of that is allocated towards nursing staff. So without having those much upper level funding increases, which is where I personally view a lot of my my thoughts towards, is very much structural change. We can't really have those increases in nursing wages, because it will and then have to, based off of current fundings, it will then have to chew into other areas of other aspects of the hospital budget, which then could impact. And I'm going to use a hospital that is in the southwestern region as an example. A few years ago, they went, I believe, $20 million over their annual budget. The following year, they were then forced to cut a significant amount of services due to those budget constraints and due to the big deficit that acquired the year before. So without having those extra funding opportunities in place to help fuel this increase in wages, we're going to see cuts to other services. And unfortunately, as many of us are already very well aware, when when hospitals are operating at a deficit, nurses are the first service cut. We have the largest we can consume the largest portion of a hospital's annual budget, and therefore we get viewed as dispensable and quite often taken out of the picture, which then, of course, as we all are also very well aware, further impacts patient outcome and impacts the community as a whole. But the other thing with the wage increase is it doesn't address, when we actually look at the reason why nurses leave the profession, wages tend to not come up in that conversation regularly. Nurses, on average, still land within, I believe, the 75th to 80th percentile of earners in Ontario, which is a fairly, yes, it's lower than other similar publicly funded professionals, which I know is a conversation that does often come up. And it doesn't make it right that nurses' wages are significantly lower and capped, whereas other similar professions aren't capped. And I'm sorry if my mind's kind of jumping around a little bit. It doesn't change the unfairness of that, but we need to kind of look towards maybe addressing those issues, that whole issue, as another issue as to why other professions are getting capped in nursing, or aren't getting capped and nurses are. And I'm sure there's a whole lot of research that can go into that.
Thank you, Matt. So Matt, I'm going to comment on that, as I did, I think, in the social media. Number one, I want to tell you that the reason your tweet captured my attention is because it really follows a very values-driven leadership, which is what I think I have tried to embed RNAO, I would say, successfully through the years, and also evidence and also courage. So let me tell you why I say you follow the three. Values, because you spoke your mind, and actually your tweet, if I may capture what you said, it was inspiring. You said, I don't mind if my salary gets increased by 1% or not. What I do mind is that I make twice what people in my neighborhood make, you said. That's number one. That's pure values. And I so can relate to it. And I think most nurses. Second, what you did, and you just said it today, which just warms my heart, despite that you didn't have a good night's sleep, you went and did a whole homework to actually bring us, and you didn't know we were going to put you on the spot. So look at that. Thirdly, you had the courage to go against the grain, because we were all pushing 1%. So that's number one. Thank you. Thank you for doing that, because we as nurses need to be able to stand up for what we believe. I do want to talk about the issue of why nurses are pushing the 1%, and it is because of the right to negotiate fair wages. The moment that, we are not a union, but RNAO understands the importance of unions. If you look at the research, and you look at which countries have better health outcomes, we better understand the power of unions in terms of being able to negotiate fair wages. The bottom line, the OMA always, regardless of the 1% or not, are somehow able to negotiate. I'm not going to go into the details of what was put in the media, on the social media, but the reality is that ONA is being targeted now even by nurses, and ONA has the hands tied. I'm not defending ONA, I'm saying the facts, right? So I think it's critically important, equally important, that RNAO has spoken forever, that we should never decrease taxation, progressive taxation. That if anything, we need to increase it so that people that are in the poor stratas of society have a better life, and by a better life, a better outcome, because income and health outcomes are completely related, guys, right? I also want to tell you that if 100% of the vaccine had gone to vulnerable populations, as RNAO actually asked for it, but it didn't happen, only 50% went, as you know. If 100% had gone to vulnerable populations, we would not have been in the media demanding second shot for nurses. But given that only 50% were going, right? The question is, where were the other 50%? And why would we compromise nurses that work in ICUs of not being fully protected, and by de facto in long-term care too? Because there are, as you know, you may not know, 1,500, the hospitals were asked to decant 1,500 alternative level care patients to the nursing homes. And we are already hearing from nursing homes that many of the staff that have been brought back to work are not vaccinated, that the people that are being decanted from hospitals are not vaccinated. So I don't need to say to any one of my colleagues here, do we need a third or fourth wave in long-term care? Like, didn't we have enough already with the tragedy on the first and second wave? So it's all these issues in context, right? But thank you so much for the information, for bringing it to bear, for speaking in the social media about the importance of vulnerable communities. That is so very important. Thank you. And always you do, Matthew, and so thanks.
Thank you, I appreciate it.
Thank you. I think we have a colleague that came here with her students, Miss Simons, with your students, PSWs. Why don't we share about the students and their inspiration, and share about your work, please? And I'm calling you Miss Simons, not because Miss Nightingale told me, but that's what says I don't have your first name. But you can be Miss Florence Nightingale too.
Thank you very much, Ms. Queenspan. So can you hear me?
Yes, lovely.
So my first name is Ikua. It just registers me as Miss Simons because we were in a class when we came in. So my background is in geriatric nursing. I work in LTC. And I also currently, I'm a program instructor for the PSW program in TDSB. So part of our afternoon session, Zoom session today was to join the webinar because I feel like they're very informative and relevant right now. So I care with all my students. I see their names in there. And I heard you call one of them Oba, but I didn't hear her voice. So dear students, any one of you who's here, I see a lot of you.
So I need to tell you something.
Yes.
You need to bring to your class a person by the name of Diana. I will put you in touch. Diana McCaime. Diana McCaime is a PSW in a nursing home. She is entering in September the BSCN program at Ryerson University. She already was twice in the media, put by RNAO. She is a star like nobody, and you must bring her to your class because your PSW colleagues or students can be proud as PSWs forever, and that's fantastic because we need awesome PSWs. They can also look at then progression in the profession, whether it is to RPN or to RN. Diana is a PSW that is going directly to RN. So the future is yours, Guy, to conquer. And Diana will be, I'm sure, thrilled to come to talk to your students.
Well, Ms. Griezmann, thank you very much, because that is what, I do want us to have that kind of mind of progression, that we're not just stopping here, that we can go further. So I got the name down. Thank you
Diana
very much.
McCamey. I am going to write it. If you send me a WhatsApp, any of you can send me a WhatsApp, I will connect you directly with her. She's amazing, amazing, amazing. And by the way, the person that introduced me to her is Brigitte Humaigua. So here you go. It's a small world, nursing. It's like
I know, right?
A colleague in Spain many, many years ago said to me, nursing is like a handkerchief. You can hold it in one hand and you can see it all over the world, right? Similar issues, just different intensity, right?
Yes. Good. Okay. Thank you very much.
Well, it's great to know that there are a bunch of PSW students on the call, and welcome to everyone. And I'm thinking, Doris, since no one else has their hand up right now, should we shift gears a little bit for a while and bring up the Padlet and work on developing our virtual wall? Are you ready for that? Or did you want a few more minutes in this with the discussions?
I wondered if I could just make a comment before you move, and it's in relation to what Matthew was talking about. And one of the critical reframing that I believe that RNAO has done with the profession of nursing is change the perspective of our politicians and many others about nursing as a high cost center to nursing as a large group of very informed voters. And I really think that has been the hallmark of RNAO over the, really, frankly, the past at least 20 years. And that's why I think we've become such a major force.
Thank you, Imogene. Very, very true and very right, and more to come, no doubt. More to come. This pandemic has, for good or for bad, given us the opportunity in a silver plate, and social media. Let's not forget social media. It's difficult where a person, well, I'm not going to name people not to get them in trouble, where some of my colleagues could be told years ago during SARS, you can't talk to the media. You cannot do that anymore today. And organizations understand that, and organizations respect that, and organizations also understand the benefit for them. You have no idea of the number of CEOs of major organizations that connected with me on this weekend to thank us that we were pushing the issue of the second dose in critical care areas, because they too are concerned what will happen with their staff, not because they will not have enough staff, but because they want to protect their staff the same as us. And the same happened with OHA. Anthony Dale connected with me in a text. People, knew that this is important. And the beauty is we got it for nurses and for everybody else, as we always do. So we can move to
we'll let Amanda speak, and then we'll move to
Amanda is here.
Yeah. Amanda,
okay, good. Go for it, Amanda. Are you with the little baby? Oh, he's so cute.
Yeah, he's in his crib right now. He's been very.
We don't see you. Do we see you?
No, I can't connect with video. I'm not sure if it's just how it's the call set up.
Olivia, can you try to enable her?
Yeah, she's put up as a panelist, so you might be able to, Amanda.
You need to, can you see the video and can you click on it? Sometimes it's locked, Olivia.
No, I see that, Amanda, you have the option. Oh,
Okay, all right.
here we go.
Can you see me now?
Yes,
Yes.
we can.
Yes.
Yep.
Yes, we can.
Hi, everyone. I wanted to share my thanks and my gratitude for everybody's hard efforts and retweets and speaking out for getting us shots, because I think I worked nights last night. I've only slept for about 3 hours. I woke up to very exciting news and a ton of messages, and I wanted to share my colleagues' gratitude and thanks as well. Everybody is so excited. We all feel a little relief, and it gives you that hope and a little bit of energy boost to keep going, because we all need that. So thank you for everybody.
And thank you for the seeds that you planted. And to your organization for understanding the importance of it.
Yes, absolutely. Absolutely.
And your great spot on the news the other night. Great, well done.
I appreciate it. Thank you. It's a crazy time to be working, but that's giving us a little bit of hope.
Yes, it surely is, Amanda.
Yeah.
Susan, back to you.
Okay, thank you. So now it's time. You should be able to see on the screen our wall that is going to be populated momentarily by your comments, your pictures. You can put GIFs up there. So what you'll see is on the bottom right-hand side, there's a pink plus notation there. Just click on it and you can start to add your posts. So, and I will refresh it regularly, and we can just, you can put anything that you want in terms of recognizing nurses' leadership, expertise, compassion, ingenuity, and courage. So go for it. We can start adding it to it. Great, already seeing some. Nice.
Such fun.
Proud of nurses everywhere. Like some great little videos, some GIFs there. So Olivia's put in the chat box the link again, so in case you haven't got it yet. And then we'll be promoting this on our social media platforms. And if you follow us at RNAO, then you can also retweet and share within your networks.
And you can tweet it, Madison, with the link so everybody can send more.
Yep, I'm on it, Doris.
Lovely, lovely, lovely as always. Thank you.
Yeah, it's filling up really quickly.
That's good.
Yeah.
It's incredible, the silver lining of COVID. Huh? We all learned to use alternatives. But look, last year we didn't even think about something like this, and it's awesome. Awesome. So this was Susan's idea. Thank you, Susan.
Well, I stole the idea. We already did.
You stole or didn't steal, but it's a good idea and you brought it to us.
Right, right.
Steal shamelessly if it's good stealing. I want to steal good wages, but I'm not going there. Not going there. We had plenty of discussion already in the social media. In any case, this is beautiful. Thank you. You know what I want to steal? I want to steal. Here is what I heard from my colleagues, and I said it in the media, that people flip a coin the night before when there is sick time. When there is a sick call, I already heard it from 3 colleagues in 2 different places, to see who will cancel the day off tomorrow so that we will not be so short-staffed. I want to steal more days for nurses to be able to a bit be with their family in their own home, to a bit be able to sleep more, because not only it affects nurses themselves and their families, it also affects patient safety. So I want to steal time so nurses can have a bit of time back for them. Frontline colleagues, nurse managers, chief nurses, all of them. And I know other professions too, but what our colleagues tell us is the intensity that they see, right? The intensity of suffering that they see and the intensity of wanting to do good and wanting to provide good care, safe care to bring people back to their own families. So let's steal a bit of time to give you back, guys. Beautiful messages, my gosh. Proud of nurses everywhere. Oh, it's gone, it's gone.
It's just refreshing.
Don't worry, don't worry.
Yeah.
Great nurses, thank you for your love and care. Anonymous, happy for health heroes. Nursing is a work. It's gone. Beautiful. Thank you to my fellow nurses in ICU and telepractice. Thank you to all on the front lines, comforting and giving good care to patients. Nurses with your heart. Oops, gone. How beautiful is this?
I wonder if we have any recognizing student nurses or late career nurses. Can I challenge people to make a shout out to student nurses or late career nurses as well?
Yeah, I saw a couple for students.
Oh, good.
Yeah. Awesome.
Great. Yeah, well, it's filling up beautifully, so we can continue to share this and encourage you to share it within your networks as well. So.
And Madison, when you share, the people will see these messages?
They'll be able to click on it because it's constantly updating.
Wow.
So click on it and it'll be updated just as you're seeing it now, Doris.
Wow. That's awesome. Awesome.
Great. So Doris, did you want me to stop sharing this screen momentarily? People can follow if they
People
look.
can continue and we can talk. We can talk as people do. I don't know if Morgan was able to join us. I know she had a gazillion meetings at her workplace. I don't think she is, right? But Morgan, if you are on, just jump in. And how much time we have left, Susan?
We just have a little over a half an hour. And we did just have the Nursing Week events that we wanted to share and a couple of action alerts.
So maybe you can go through the schedule of Nursing Week events, please.
Sure. Are you seeing it on my screen okay and not the Padlet anymore?
Yes.
Good, okay. So we encourage you to go to our Nursing Week portal, and it lists all of these events and provides a bit more detail, and you can register as well. So that's just Nursing Week at RNAO.ca.
Oh, today is so I would like to go, here you go. Let's go through each one of them. You have them in the next.
Yeah. So today and ongoing is Take Your MPP to Work live. And this is something that we have done every year, but the second time that we're doing it virtually. And it gives some members an opportunity to meet with their MPPs and understand the depth of nursing practice and let you connect with politicians in your area. So that's hearing from nurses and colleagues in various settings. So we're really excited about that. Jean, feel free to add more to that if you like. But maybe I'll walk through the other ones too. We have RN careers. That is also, actually that already happened today. That was tips on cover letters and resumes. We also had today one-to-one resume review sessions, and that's happening again later on in the week in case you missed it. This is the COVID webinar series, so that's today. Interview tips and preparing an elevator speech. So in case you want some tips on how to prepare your own elevator speech, or some tips on how to effectively interview, especially in a virtual world, join us. That's tomorrow morning. And we also have 3 colleagues from RNAO who are just jumping in, and they're going to give their own elevator speeches for others to hear some examples. We have our Nursing Now Ontario Awards, and that is May 12th. That's Wednesday from 2 to 3. And this is to celebrate the contribution of nurses who have contributed to our profession, and we're hearing from registered practical nurses, RNs, and nurse practitioners. So those are the Nursing Now Ontario Awards, which we're excited to hear who the winners are. And then Wednesday afternoon, this is the open forum for nurses. And this is this is our continuing the conversation series. At this time, we're focusing on looking at answering the questions. We're going to go into breakout rooms and also invite politicians to join the conversation, but figure out what can we do to help keep nurses in the profession and prevent the exodus that we're noting from our survey is possible to happen, especially amongst younger nurses. And then on Thursday, we have the one-to-one resume review sessions. So that is you're paired up with an experienced RN who can review your resume. So we did that today earlier, and we're doing it again on Thursday. So that's our lineup of events for Nursing Week, and we hope that you will join whatever is most meaningful for you. Doris or Imogene, do you have anything more that you wanted to add?
No, I think that this is excellent. And I think the more you can join events, if you have time, then that would be fantastic. And we also hope that you take your personal time, whether it is 5 minutes of more sleep or 5 minutes of doing gardening, 5 minutes of a walk, or whatever it is that will allow you just to sit, reflect, and pat yourself and stand. It reminds me, KRP, stand tall. You are a nurse. Stand tall. We are nurses.
Great. Doris, I'll pass it on to you to talk about our action alerts that are happening.
Thank you. So this is very, very, very important. This is about the fact that unless the poorest of the poor of the nations and their people are vaccinated, no one else will be safe, right? It's as simple as that, no different than in our own communities. So right now, the UN and the World Health Organization and many others have urged the country's leaders, the nation's leaders around the world, to actually do away with the vaccine patents for some time, to enable really the mass production of vaccines so that most people in the world can be vaccinated, not in 2-3 years, but actually sooner than that. The first one that answered the call, and I was both surprised and inspired because pharma has a big power on leaders, as you know, but the first one that responded to the call was President Biden. He already made a decision that they are going to waive the patent. Our Prime Minister, in a very elegant way, said that we will look into the issue, and many understood that as he will follow suit with the US and President Biden. My understanding, based on people that are closer to the fire, is that perhaps a decision to the opposite has been made. I hope that that's incorrect. There is a group of MPs, including from his own party and from others, that have begged to follow suit with the US. We did put a press action alert. The action alert is getting traction. We need a lot more people to sign this action alert. So please sign this action alert for vaccine justice, is called. Sign the action alert to really uh, do away with the letter patent until such a time that the rest of the world is vaccinated. So please, 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 we urge you, it's one of the most important actions you can take today to protect the poorest of the poor in other countries. You do need to understand that while we are very concerned if we have 50% or 60% or where we are with the first shot, in some other countries, they don't even have 5%, 2%. So please sign it today and send it to all of your networks for them to also sign and to put pressure on the federal government, on our prime minister, who, by the way, has performed exquisitely in many things related to Canada, including, helping financially those that are less fortunate and don't have work, etc. But on this, we need him to respond to the world, not just by giving back vaccines that we will have left, but actually by removing the letter patent to join the movement of President Biden so the mass production can happen as we speak, and then countries can vaccinate their people the way that they need. Their lives are not less important than ours. So thank you, Susan, for allowing me to share with people, with the participants. Nurses must be fully vaccinated. Well, the latest is the news I gave you. There is a discussion going on between colleagues in the social media, rightfully so. I would suggest Ona put a tweet saying, we got it, we did it. Well, Ona did it. Let me be clear, I don't want to ever undermine Ona, but on this, RNAO did it, but we are not taking credit for that either, because RNAO, without Brigitte and her hundreds of retweets, and without Gritty Nurses and hundreds of retweets, and without Amanda that brought the seed of what was happening, and without the many, many of you that put the pressure, this would not have happened. So let's not try to score points, because RNAO didn't try to score points. Let's understand that Nursing United is stronger and we can achieve a lot more together. So please do not retweet that piece that says we did it, whether it's on or whoever. Just retweet we did it together. And Madison, if you can put our tweet back there and just retweet, this is the collective good of nursing for the benefit of everybody else, because at the end of the day, we achieve it for everybody. Thank you. And I do also want to tell the importance of specific CEOs without giving their names, that also on the back room of the negotiations were pushing for this and saying we agree with RNAO. So this is not about taking credit, guys. This is about people will be vaccinated and fully protected, and that's what we need. Thank you. This is a very important piece that is action alert went out today. This is our colleague, Professor Cheryl Forchak from University of Western Ontario. She put a resolution. I don't know if Cheryl is here or not. I don't see her name, but let me comment on that. She put a resolution in 216 to RNAO that on the issue of assisted devices, the issues of mental health had been forgotten. There is a debate. The first reading already passed. This is the debate will happen this week on the second reading, which is the most important, because that's when really things get stalled and don't happen or happen. This is a bill moved by Bill 277 by Teres Kenargan, to really extend those assistive devices programs to include assistive devices to support individuals with mental health needs. Just picture Cheryl did, I remember years ago, research on, you know, these gadgets and how much they support and prevent suicide, prevent people from becoming more depressed, prevent people from feeling disconnected, and prevent, you know, people from being hospitalized. Thousands, millions of dollars could be saved with assisted devices that simply give a better hand to people with mental health. So we are pushing the premier to encourage his government, because they have majority, to pass Bill 277. And we absolutely ask you also, all of you, to retweet. With that, let me remind you that in my blog, I had a piece on this, and also in the Loop. Madison, if you can put a link to the blog and a link to the In the Loop, you will have that. And also the Action Alert, Madison will put a link, or Imagine, or Susan, or Olivia, so people can sign. Do it soon, because this will happen this week. And this is hugely, hugely important. And I do want to thank Professor Dr. Cheryl Forchak for having put that resolution, and for having proceeded to continue to work with political parties, with all of them, and getting an MPP and supporting into moving this from, you know, research into policy and into action. And we are augmenting that with political advocacy, which is what's needed to push it forward now. Thank you, Cheryl, hugely to you. Next one, please. The COVID webinar on Monday, June 19. You want to share with us, Susan, the focus?
That's actually a month from now, so we'll announce the topic
Oh, that's
of the
June.
next COVID. Yeah, that's just a reminder that we are continuing this COVID-19 webinar series, and the topics just range from one month to the next, depending on what the hot issues are, what we're hearing from people that they want to talk about. So yeah, just stay tuned for that, but you can register in advance if you like, and then find out what the topic is closer to the time. Yeah, so Doris, that's it. I'm going to stop.
I am not done, because I think we have a colleague from Qatar. Arlene, you may not be aware. Hi, Dr. Doris. This is John Glodoseva from BPSO Qatar. Truly, in every webinar I have attended with you in attendance, it's always inspiring and motivating. Saying my regards. If he is here, put him on the screen. We have people from Qatar. Is he here? Is John here? Maybe he left at, what time is now? Oh, here it is. Here he is. He's saying, yes, Dr. Doris, put him on, Olivia. What time is in Qatar now, Arlene?
I think it's 3 plus 8, 11 in the evening.
Yes.
11 p.m. We must put him on if he stay up all this time. Oh, Amanda,
Oh, hello.
Look, Amanda, he's gorgeous. He woke up now.
Okay. Hello, Dr. Doris. How are you?
Hi, John. Good to see you.
Yeah, I actually just been to clinicals, and that's why I had an opportunity to join the webinar, and I have seen how you your motto. The last time you had the webinar here in Qatar, you've been talking about your 3 motto, and I just like got reminded of that. So yeah, it's amazing.
Well, the work you guys are doing in Qatar is amazing, and your students are inspiring us all the time. So thank you to them and to you, John, and regards to everybody there, and to our leader there also.
Thank you so much,
To
Dr. Doris.
Joanne McDonald, Center Our Lab.
Will do. Thank you.
Thank you. Okay, Susan, I think we are ready to probably say thank you to everybody. I think we passed a bit the time, and you have been very generous, everybody. We still have 100 of you with us. So thank you, thank you, thank you. On behalf of the Board of Directors, Morgan Offart, President Morgan Offart, immediate past President Angela Cooper Brathwaite, our board of directors, our awesome, awesome assembly of leaders, our staff, and all of you, whether you are a member or whether some are to be member in the future, like Amanda's son. Thank you, thank you, thank you, thank you, and happy Nursing Week. Take pride, stand tall and take pride. You are a nurse, we are a nurse, and you are awesome, and we are awesome.
Bye, everybody.
Bye, bye everyone.
Happy Nursing Week.
Happy Nursing Week.
Happy Nursing Week. Happy Nursing Week, Betty, Anita. I see some of my board members now. Happy Nursing Week to all of you.